Hi, everyone. Thank you so much for joining us for our second installment of Justice in Action, Ruth Messenger and Brad Lander on New York City and COVID-19. In this series, we're going to be taking a look at the way that COVID-19 is exacerbating existing inequalities in New York City and how each of us can take action to address the problem. Today, we welcome Joel Berg, CEO of Hunger Free America, and David G. Greenfield, CEO and Executive Director of Met Council, to discuss New York City's growing hunger crisis, which is being intensified by the global pandemic. Thank you to all of our panelists for being here and for sharing your insights. If any of our attendees have any questions, I want to encourage you guys throughout the session to ask them at any point in time. We'd love to have you be a part of this conversation. If this is your first time using Zoom or you're new to the platform, if you take your mouse over my face where you see me speaking and you bring it down to the bottom, you'll see a chat button and you can click on that and you can type in any questions and I'll see them and share them with our panelists. And if that proves to be like it's not working for you, you probably have my email because I emailed you the link and you can send questions that way and I will make sure that the panelists hear your questions. And that's about it. I'm going to hand it over to you, Ruth.
Okay, so just to set the stage again, folks, this is from the Marlene Meyerson Jewish Community Center on the west side of Manhattan, which has a thriving Center for Social Responsibility headed by Cheryl Parker and chaired by Vicki Abrams, both of whom are on this call. And we do lots of programming on lots of issues, but it occurred to us, of course, to figure out a way to go viral, to go Zoom and reach people that way. But it also, then we decided to engage with City Council member Brad Lander from Brooklyn and to focus our attention on the many populations in New York City who are in worse shape right now and unfortunately going forward because of fallout consequences from the virus. So before, Brad, I ask you to identify some of those groups, I think on behalf of both of us, I want to say to everybody, first of all, we appreciate your calling in. But second of all, we know that every single person on this call is in some way affected by this virus, by the need to shelter in place. More and more of us know people who are sick or know people who are losing their lives. Some people on this call have lost their jobs or are afraid they will lose their jobs. So I want to say we have huge concern for every single one of you. And there are places at the JCC, at Brad's office, in your own communities to get answers to pressing questions and to get specific help. But I thought that, Brad, that maybe we might just list now some of the populations that are on our minds as people who, for one reason or another, are in worse shape. And I'll mention that last week we talked to the wonderful Dr. Rachel Bedyar, who is a physician at Rikers, talking to us about the incredible current and projected future spread of the virus among people in Rikers, and gave you all something to do about that. And today, in a few minutes, we're going to shift our focus to the specific issue of food availability, food pantries, hunger, as it's always existed in New York and as exacerbated by the virus. But first, Brad, you're in touch with many more people as a current elected official. What other groups are on your mind?
Yeah, thank you. I think that's, well put. And I think, what we did last week really showed how the pre-existing injustices in our criminal justice system now are exposing inmates and prisoners to harm, but then also corrections officers and healthcare workers and folks come back. So our whole society suffers from that harm. We're going to talk today especially about the food crisis and how the ways in which the weaknesses in that system of making sure everyone has good, nutritious, adequate food are now showing up and being magnified. But that's happening, and I think the way you put it is right. This is such a, there's obviously the worst kind of suffering is to be dying alone or to be the doctor who has to decide who lives and dies. But there's so many other kinds of suffering that are showing up. So a whole set of workers are experiencing just enormous pain right now. And that some folks who are on the front lines, obviously we're seeing healthcare workers, doctors and nurses and healthcare workers who can't get enough personal protective equipment and are putting themselves in harm's way. I saw just like yesterday, some doctors got fired just for speaking up about the conditions in their hospitals. So we don't think of doctors generally as being vulnerable workers, and yet here they are, vulnerable in their health and vulnerable in their worker protections, set of
Right.
other workers who have to keep working. There was a set of strikes at the Amazon warehouse on Staten Island this week, where Amazon workers, who we might not think of as like frontline healthcare workers, and yet they're working more hours than ever before because so many people are ordering packages to their homes. And Amazon, the workers say, has not done enough to protect their health and safety. Whole Foods workers said the same thing. Instacart workers, the same thing. I mean, there was an enormous amount of labor action and unrest because all those workers who don't have a union, who don't have enough health and safety protections. Last night we did a call, we might come back to this in a future week, with freelancers and artists and gig workers. Those are mostly folks who have lost massive amounts of work. I mean, we all know obviously that like music and poetry and art and movies are essential, even if different from healthcare, and all that work is gone now. And we haven't built a good social safety net for the changing economy. And so those folks don't have traditional unemployment insurance, don't have traditional paid sick leave, don't have retirement security, don't have workers' comp. So all the ways in which we've built a weak social safety net for different kinds of work. And then, you know, I think, Ruth, you and I talked about at some point in the future doing a call around the increase in domestic violence that that is taking place. You know, we've got this pre-existing misogyny and sexism in society, and that we know right now that's showing up as people stuck in their homes, and women are vulnerable to intimate partner violence from their partners. So that's just a short list, and there'll be others that we're looking at. But I think the ways that the crisis shines that spotlight on and magnifies those things and then amplifies that harm, we're really seeing in a long list.
Right. No, I think that's the list, and I'm sure the list can grow. And I would just say to any of our participants, and there are 60 of you on this call, we're delighted to say, can think also of populations or issues that you'd like us to address, please do. Somebody in my chain of circles of communication today pointed out that he's been on, well, he said 600,000, obviously he was exaggerating, but on thousands and thousands of Zoom calls, and he's not yet been on one that had closed caption signing. So just as one of many examples. Brad, why don't you set the stage a little bit about food and hunger in the city as you know it and experience it, and then we'll go to Joel and then to David.
That's great. I'm not going to do too much setup here because we have two of the foremost experts, like both nationally and in the region, on food, emergency food, nutrition, the hunger crisis. So I think here I will just, rather than give you kind of public policy facts, tell a little personal story. I decided on Tuesday to go out and do a volunteer shift at Masbia Soup Kitchen, which is now functioning as a food pantry, not a typical soup kitchen, in Borough Park. And that's something that I met together with David Greenfield, who represented them when he was in the city council. But after Hurricane Sandy, we had 500 frail elderly at the Park Slope Armory who have been evacuated from nursing and adult homes in southern Brooklyn and the Rockaways, who spent 6 weeks living in this armory in cots on the drill floor. And what the city had sent was meals ready to eat, like astronaut MREs, because there's no kitchen at that facility. And that was not going to work. The doctors there said, if you feed this to these elderly, frail elderly, then some people are going to go into a diabetic coma. And so I called City Hall and told them that, and they're like, well, you're on your own. So what I did was I called Met Council. I called David Greenfield's predecessor at Met Council and said, what are we going to do? And he said, well, let me connect you with Masbia Soup Kitchen. They're an amazing kosher soup kitchen in Borough Park. And I called up Alexander Rappaport, the director there, after Met Council had connected me. And he said, well, the electricity's out, but the gas is still working. So I think I can get some folks in. And they cooked 500 hot meals every day other than Shabbos for the next 6 weeks, and kept those folks alive and fed and feeling loved too, like to have a hot cooked meal. So I've got a deep connection to them. So in this crisis, I knew they're having to shift. They set their model up to be like a restaurant where you could go in and get a meal. And actually, David and I were together. We did like a little celebration of my son's bar mitzvah to help raise money for them. Obviously, they can't do anything like that now. So they have shifted to be a food pantry, giving people 2 weeks worth of produce and other food. And I, worked the line. I was doing the check-in of people from social distance space. But my goodness, the challenge they are facing that we're going to hear about from Joel and from David are really overwhelming. Normally, they have a set of regulars who come there, and most people who come are already part of their system. 80% of the people that I checked in, about 100 people that I checked in this shift from 3 to 7 on Tuesday afternoon, 80% of them were in a food line for the very first time.
Oh my God.
That's the increase that we're seeing, and just a set of people who didn't expect to be there. All the issues of kind of feeling shame that go along with that, but also the institution itself is facing a massive challenge in how to rise to meet that need. And so we're so lucky to have two people who just know more about hunger and nutrition in America and New York City and the challenges that are being faced right now and what we need to do to rise to it. With us, Joel Berg is the executive director of Hunger Free America, which way back when it was Hunger Free New York City, and before that, New York City Coalition Against Hunger, and David Greenfield, who is the president and CEO of Met Council, which is, he'll tell you more, but an extraordinary, the largest Jewish kind of charitable and social service organization in the area, and one of the largest providers of emergency food as well. And he is my former colleague in the city council, where he did a lot of good work in the council, but the life-saving work that he and the Met Council team are doing right now is really, truly remarkable. So we're grateful to have you both on, and we thought we might get you back to back, but I'm so grateful that you're both here. So instead of doing one of you and then questions, and then the other of you and then questions, why don't we have you each give an introduction, and then we can spend some time with questions from Ruth and I and from.
And I'd love it if you can, Joel, you should go first, but if you can do it quickly, which I know is really hard, but trace that a little bit of the trajectory that Brad spoke to. You've been doing this for a very long time. So if we'd had you on 4 months ago, you could have told us all of the issues of hunger and food pantries and whatever in New York City. And now it's all compounded, somewhat different, somewhat the same. So try to give us the broad picture and then the COVID picture.
Thank you, Ruth, and thank you, Brad, for your leadership. I'm a constituent of Councilman Lander, and he's just a great public servant. So we really appreciate all your leadership, Brad, and all of Ruth's lifetime of service. I will just show you, can't really see, I'm wearing a shirt with the Keep Calm, a symbol from World War II in Britain. It's Keep Calm and Fight Hunger. I got from a food bank in southern Texas a few years ago. Well, worser isn't a word, but it should be. And the bottom line is things have gone from worse to worser. And I will be very quick about the background on this, but as of 2018, when the economy was still in supposedly great shape, when the unemployment rate was the lowest in modern history, when the stock market was at all-time highs, there were more than 1 million low-income New Yorkers who lived in households that couldn't afford enough food, according to Hunger Free America's research of federal data. A few 100,000 children lived in those households, many of whom were working people who just weren't earning enough to pay for rent and food, etc. About 1.3 million people were getting SNAP, the current correct name for the food stamp program, and a few 100,000 people were eligible for SNAP under the law and not getting it. And many people who I think should be eligible for SNAP aren't under current law, could not get that help. Certain categories of immigrants, certain categories of middle-income working people who are still really struggling in New York. In 2018, New York City had the lowest school breakfast participation rate out of any big city in the United States. About half the kids who got school lunch did not get school breakfast on a daily basis, something we've been pushing the de Blasio administration on repeatedly. And over the summer, about only 15% of the kids who got school lunch got school breakfast. So 85% of the kids who get school lunch during the year do not get school breakfast. Pantries and kitchens and great work by City Harvest and the Food Bank of New York City and the Met Council and between 800 to 1,000 soup kitchens and food pantries in New York were doing amazing work then. But keep in mind how really minimal the charitable response is to the government response. Even with the under-participation in the federally funded programs, the federal programs provided at least 10 times the food purchasing power of every dollar spent on pantry and kitchen and food bank food. So the federal safety net, even underutilized, is at least 10 times and maybe 15 or 20 times the amount of the charitable response. And while 800 to 1,000 soup kitchens in the city sounds like a lot, many are only open a few times a month. Some are, very few are open every day. And there are 8,000 retail establishments that accept SNAP food stamps. 8,000 retail establishments that accept SNAP, food stores, bodegas, grocery stores, farmers markets, etc. So there are 8 times as many places where you can get food with those benefits than you can, pantries and kitchens. So our message is, in the best of times, pantries and kitchens and food banks should be funded and adequately supported, but we should understand that they are not the long-term answer to hunger, and they also don't bolster the food industry the way they should. And so our message then is the same message now. The single most effective way for government, for state and local government and philanthropies to fight hunger is to bolster participation in the federal nutrition assistance programs. So that was then. Now we've had about 1 million meals a day at New York City public schools not being served. We have tens of thousands of meals at New York City senior centers not being served. We have the most massive and rapid increase in unemployment possibly in American history. It's not quite as bad as the Great Depression, but it actually took a few years from the stock market crash of 1929 to the height of the Depression in 1933 to have that massive unemployment. We've had much of that in just a few weeks. And then, despite the heroic work that agencies like David's, the Met Council have been doing in soup kitchens and food pantries, a number of them have been forced to shut down. Many of them are run by unpaid volunteers, many of whom are older New Yorkers, and we don't want them at the extra risk. And that's why I say things went from worse to worser. And I was fighting with certain people online about de Blasio's decision, not to close the schools immediately. And I said, I'm no epidemiologist, so I won't argue on that. But people who are poo-pooing the hunger implications of this don't know what they're talking about. This is very serious. And some conservative, person on Twitter said, oh, just get a few pickup trucks. I said, New York City public schools deliver nearly 1 million meals a day. That would be the equivalent of a pickup truck delivering 500 meals a day, which would be enormous, 2,000 times. And so you can't just slough off the challenge we are dealing with. So our view, what we need to do now is, yes, the council and the state and the federal government should ensure that pantries and kitchens and food banks and groups like the Met Council are adequately funded with food, but they also have to support efforts like ours and lots of other groups to help sign people up for benefits. We do so in English and Spanish and Cantonese and Mandarin. We have materials in Polish and French Creole, Bengali, etc. And then 2, we need a massive system of delivering food to people shut in at home, because it defeats the whole point of social distancing if you say, hey, everybody, come to your disease school to pick up these meals. So none of these are easy undertakings. We're calling on government to do over a matter of weeks what normally government would take years to do. I worked for the federal government for 8 years, so I don't, limit the complexity of this at all. I do think, on a bright note, after having criticized the city, I will say one thing we're doing very well is access to SNAP. Because of Commissioner Banks changed the policies of the Bloomberg and Giuliani administrations for the better, that it is much easier in New York City to access SNAP food stamps benefits online than any place in the whole United States. They've miraculously gotten to waive the requirement that you have to go into a city office to get cash benefits. And so that's, again, things that would have taken months or years, they've done in weeks. So I am hopeful that the city will do a good job with help from groups like ours and the Met Council, helping people also get benefits. I'm sorry I spoke so slowly, but before this happened, I did spend some time in the American South, so I've slowed down.
Okay, Brad, you want to start David off, please?
Sure, yeah. So, and I introduced him before, but I'm actually really glad to introduce him again, because, I sometimes feel like the Jewish world can be pretty divided into those organizations that are thought of serving more the Orthodox or Haredi communities, and those that are thought of as serving or relating to maybe the more liberal communities. And Met Council transcends that every day, not just in the crisis, and David will talk about their footprint all around the city. But if there were ever a moment for us to kind of look beyond the lines that we sometimes allow to divide us, this would be one. I don't think it's a secret on this call that there is a lot of COVID in Orthodox communities. And yes, I mean, people saw pictures of some people continuing to go to weddings or to simchas after, the mayor had closed the schools. But just like you don't deserve COVID if you're, a healthcare worker or a corrections officer or a prisoner on Rikers Island, you sure don't deserve COVID because you went to celebrate a wedding and you didn't get enough healthcare information to help you understand why you shouldn't do that. So our responsibility to bridge across those lines, to see each other compassionately, and to build the safety net together has never been more clear. And Met Council really is just an extraordinary institution for building from the entire strength of the Jewish community to show up, not only for Jews who are vulnerable, though certainly for Jews who are vulnerable, but for all New Yorkers who are vulnerable. And David can talk more about what they are and are doing now, but I just feel very grateful for the work they do and for how much he was actually an early adopter. I happened to have a meeting with him in his office before the clarity to me of what this was had come. And he was one of the first people that backed me up and did an elbow bump rather than a handshake and said, we have to get this organization ready to show up for tons of vulnerable and frail people, for homebound seniors. He had a far-sighted vision of what was going to be necessary and has really stepped up and implemented it. So as much respect as I had for him as the chair of the council's land use committee and a very extraordinarily effective elected official, what he's done in Met Council and especially in this crisis has been tremendous. So David, we're honored to have you here. Thanks for the work you're doing, and please talk to us about the work Met Council is doing and the challenges you're facing.
Sure. Brad, really thank you for that very generous introduction. I'm sorry, my mother's in quarantine, so she wasn't able to hear that. She would have appreciated that. But I will say that I'm really thrilled to be here with you, really an esteemed panel. You were a great colleague in the City Council. We've done a lot of great stuff together. Brad and I served neighboring districts, which was certainly fun and interesting. We worked on a lot of different projects together. And very grateful to be here. And everybody's favorite borough president, of course, is Ruth Messenger. So thank you so much for your terrific leadership. And we couldn't ask for a better national spokesperson for hunger and hunger issues than Joel Berg. So thank you, Joel, for your outstanding national leadership on this issue. The 60 seconds first on what Met Council does, and then we'll talk sort of pre-COVID and post-COVID. And Brad is correct. I've been very worried about this since the first confirmed case in New York and sort of follow these trends closely. And certainly saw from my experience as a council member post-Hurricane Sandy what that devastation did. And quite frankly, this is a lot worse than any natural disaster that we've ever had. And so Met Council, big picture, we're the largest Jewish charity serving the poor in the United States, but our focus is on the New York region. And as Brad actually pointed out, we serve Jews and non-Jews. We're very proud of that. And we're also proud that, practically speaking, we're really the only Jewish communal charity that serves every segment of the community. So we have 76 affiliates, from offices on the Upper East Side of Manhattan to Washington Heights, to the Bronx, to Sotmer, Williamsburg. And by the way, I'm very happy, Brad, if folks have Q&A about sort of what happened and the misinformation and miseducation. I think a lot of folks, just 10 seconds on that in terms of what happened in the ultra-Orthodox community is a lot of folks don't realize that they actually get their major source of news in the ultra-Orthodox community comes from conservative news outlets like Fox News, and those conservative news outlets were downplaying coronavirus, and it literally took a call from the White House until the Hasidic community actually took it seriously enough because they just didn't believe the news reports. And that's something that is frustrating for a whole variety of reasons. And both Brad and I were yelling and screaming about it, and people looked at us like we were crazy. The work that we do traditionally is focused on people who are impoverished in New York City. Our focus is on the Jewish community. Our services are open to everyone. For example, we have 21 buildings that are exclusively affordable housing across New York City. People always ask me what's affordable. On average, we charge $391 per month for rent, including utilities in a doorman building. I think everybody would agree that's affordable. We have apartments on the Upper East Side of Manhattan, and we do 10 different things. And in general, we focus on the reality of which is that New York City has cyclical poverty in different communities, and everything from seniors who are impoverished to folks who fall into crisis to victims of family violence. That was pre-COVID. Pre-COVID, we served 225,000 people a year through 10 different programs, and our focus is really on trying to relieve poverty. We have completely shifted our operations in the last 30 days to focus on a post-COVID world. And one of the things that we actually do is we are the largest free kosher distributors of food in the United States of America. We supply food to 149 sites. Joel actually pointed out something which is very important that a lot of people don't realize. Of the 149 sites that we supply food to, 40 are what we would call regular food pantries, right? That means that they're open on a regular basis, they have regular hours, they actually have staff and volunteers. But 129 of them are actually not, so they're occasional. That means that we might bring in food once every couple of weeks to a senior living facility or to a synagogue, or we actually just did a delivery to a church in Queens, right? And those are not regular, those are based on occasions or holidays or Passover or Easter, and they all have certain challenges. What we're seeing right now, specifically on the food, and then I'll talk a little bit more about the bigger issues, there's a micro and a macro issue that's happening right now around food. And I'm going to use a slightly different term than Joel. This is a crisis. And this is a crisis that we've never faced before in our entire lives. And we're actually one of the oldest Jewish charities focused on poverty. We're 50 years old. I actually, believe it or not, I have 3 staffers who started with us 50 years ago who still work for us. And we pride ourselves on the fact that people like to work for the organization, and there's a very high quality of life and a satisfaction from the work that we do. They have told me, and I can tell you, that this is the worst crisis we've seen in our lifetimes. We can't even right now comprehend the extent of how challenging it is. Nearly 500,000 New Yorkers applied for unemployment in this past 2-week period. And reports are there's another 500,000 who actually tried and have been unsuccessful. That is literally 10 times more than would normally apply. And a lot of these jobs, right, unless you believe the president, and quite frankly, I don't on these issues, they're not coming back next week or in 2 weeks, right? So the 2-week pause is just silly, right? So if your restaurant is shut down, it's going to be shut down for a while. And if your business has faltered, it's going to be faltering for a while. So we've never seen a need like this before. The reason, quite frankly, that I've been cutting in and out in terms of video on this conference is because while we're talking, I've been working the lines on Albany. We've been really leading an effort along with our friends in City Harvest, and we appreciate the support that Brad and Ruth and Joel have all provided as well to try to get emergency funding in Albany. And Albany is a challenging place to get things done, and we thought that we had a deal in place, and it seems like that deal fell apart, and we're still scrambling to try to see if we can get something done, which would be simply to get $25 million in emergency funding to backstop food pantries. 32% of food pantries in New York City have already closed. That's shocking when you think about it, because the practical implication is that at some of our pantries, we're seeing a 300% increase. I have one of the few remaining pantries in Southern Brooklyn called me before the weekend. We do a regular delivery there. We give them food for 2 weeks. They ran out in 4 days. On Friday, they had 3 times as many people showed up. They begged us for more food, and of course, we sent out another truck. But I want you to understand why there's so many challenges. The micro issue that pantries have is that number one, most pantries, to the extent that they have staff, they have 1 or 2 staffers, and they're staffed by volunteers, and almost all of those volunteers and staffers are over the age of 60. It is the government's guidance that if you're over the age of 50, you actually should not be volunteering, and if you're over the age of 60, in many cases, you might have an underlying health condition, you actually need to quarantine, right? So there goes the staffers and the volunteers, problem one. Problem two is logistically, even just keeping the operations flowing is very different, because we like to keep our pantries in a grocery style where you come in and you get to pick the items. We can't have you inside anymore because that transfers the disease, which means that you need to be standing outside and we have to pre-package. So actually more people power is now necessary than ever before. Problem number 3 is that they're actually running out of food. And look, people do this and they do this for the right reasons. And everyone who does this is basically a volunteer or a half-time worker. And they're not making a lot of money. It's a second career, or they believe in it. Nobody wants to get yelled at by hundreds of people when they run out of food, so they shut down the pantries. That's the micro problem. The macro problem for organizations like ours is you should think of us as a wholesaler, essentially. We buy food directly from the manufacturers and distributors. We have 2 warehouses. We stock up the food. We then supply these food pantries for free with food that they need, and all of our food is exclusively kosher. Our food prices have gone up, in some cases, 300%. People think I'm exaggerating, and no one believed me until Reuters did a story about this 3 days ago. The wholesale price of eggs has gone up in the last 2 weeks from $1.03 a dozen to $3.09 a dozen. Now, that may not sound like a lot, but you should understand that we purchase on average 100,000 dozen eggs every 3 days. $200,000 cost differential from us. And by the way, take a guess. What is the most popular time of year when people want eggs? Passover. That is the most popular time that people want eggs. Ritually and for other reasons, they want eggs. So we have a huge demand of eggs. We have spent just on additional food in the last 10 days alone, $1 million. That doesn't include $300,000 that we've actually spent on personal protective equipment. We're like hospitals. Our food operations do not shut down. This is based on clear guidance from the Department of Health. So just because someone has coronavirus doesn't mean we say, okay, we're done. Our guidance is very simple. If you don't feel well, don't come in. And while you're in, you have to wear gloves and masks because there's no other choice. So we have to buy it. When the governor of New York says he has to pay $5 for a mask, you think, I can get a better deal? Of course not. We have to buy tens of thousands of masks and gloves and Purell to keep our employees safe so that we can keep operations going. Our food costs have actually tripled. And then logistically, our staff is out for the same reasons that other folks are out. They're sick, childcare needs at home, they have relatives, they need to be quarantined themselves. So the challenges that we're facing are quite frankly unprecedented. So we're retooling as best as we can. We've actually pushed out 1 million more pounds of food in the past week to try to meet up with the demand. It's still not enough. We're actually doing another 6 emergency distributions today. We're doing one in Borough Park. We're doing one in Crown Heights. We're doing one in Washington Heights. We actually did one this morning in the Bronx. We're literally doing everything that we can, but it's not enough. And we're also trying to figure out how do we deal with folks who are at home. Thanks to a private grant that we got, $100,000 from a private donor. Today, we launched a pilot for the first time ever. It is a pilot, so I just want to be clear, we're not up to full capacity yet. We are now delivering 500 packages before Passover to Holocaust survivors who are shut in their homes, and it's something, of course, to expand in the future. You would think during times like this that government would be there. The problem, quite frankly, is, and I'll just leave with this final point, is no matter what you think or say, there is no poor people lobby. Nobody goes up to Albany and sits there and says, I'm not leaving, and you're not going to get help, and we're not going to vote for you if you don't take care of the poor people. And that's a problem. So we're doing the best and we're advocating, but it's a real, real challenge that we have faced. And so we're certainly pivoting as we can. But honestly, if anyone tells you they're prepared for this, they're lying to you. Nobody is. And it's going to be overwhelming. And I'm telling you right now, government and society, we're failing people when they need it the most.
Wow, thank you. Thank you both. So I have one question which maybe has become peripheral, but it was my impression that some of the loss of benefits and support to people moving into this virus situation was because of the purported federal ruling that people would not be able to apply for citizenship or green card status if they were quote unquote a public charge, and that was not defined, but that some people literally took it to mean if your child gets free breakfast, then your immigrant status is going to be challenged. And I just wondered if each of you would say something about that, and it may be one of the action items that we want to recommend to people. Joel?
Sure, I'll start. I should say that there is a poor person's lobby, myself included, but we are way outnumbered. And, there's some elected officials who are fairly rare, like Brad, who give equal attention to lobbyists like us. But to be blunt, we're often sitting in the outer room talking to the legislative assistant's intern's deputy when the banking donor gets in and meets with the assemblyman or the senator or the congressperson or the senator. And that's the issue. And we need to do a better job of engaging the low-income people most affected in lobbying for their own behalf. And that's a key thing we need to do in the future to actually win, because no social movement's been won by one people on behalf of another. Anyway, the specific question about the public charge, and I feel passionate about this. My mother came into Ellis Island at literally 2 months old through Poland. Any of her family that did not get here was wiped out. And I see we're a nation today of anti-immigrant immigrants who have awfully short memory spans about this. And I particularly say to fellow Jews who are opposed to new waves of immigration, if I may say, shame on you. And unless your last name is Rabinowitz/Iroquois, get over it. So that's number one. Number two, the public charge rule is a complicated rule. It does relate to SNAP benefits, which used to be called food stamps, benefits, certain healthcare and housing benefits. It does not include the Women's, Infants, and Children program for pregnant women and children under 5. It does not include soup kitchen and food pantry food. It does not include school meals. That being said, as you said, Ruth, a lot of immigrants think it does. And a lot of immigrants are afraid that if they get those benefits, it will hurt their ability to stay in the country. So this supposedly religious president is basically saying people have to choose between staying with their families and their families staying together in the same country, or losing food and medicine and housing. It is absolutely appalling, absolutely hypocritical. And people ask me what I would do with it, if I had a time machine, and the obvious, I would go back and kill Hitler when he was still young. The other thing is I'm pro-immigrant to my bones, but I may have prevented the Trump family from coming into Ellis Island, since they were gonna turn on immigrants so much. And beyond our rhetoric, this is real. Programs not affected by this technically, such as the WIC program, have seen a dramatic decline in applications. Even for the SNAP program before this, immigrant neighborhoods that had the highest immigration population had the highest under-participation in SNAP. And so there are two objectives: to legally make it harder for people to get benefits, and just to impose fear on people, unfortunately have succeeded. And the Supreme Court ruled, some courts stopped this, and the Supreme Court ruled 5-4 along obvious, predictable lines to allow this to get forward. And we are not a partisan organization, but I will just say, if anyone on this line still doesn't think elections matter, or that both sides are the same, you are just wrong.
David.
Yes, so certainly, Joel. And I think that what we've seen, honestly, is, and we're very proud of the fact that our policy has always been and continues to be, is that we serve everyone regardless of immigration status. And we have 11 different languages that we speak at Met Council, so that we can service folks from all over the community. In fact, we're actually very proud that we serve more Hispanics than most Hispanic charities because of the size of our footprint throughout New York City. And we've seen that over 20% of folks in terms of recertifications are actually declining to recertify because of the public charge rule, and they're actually afraid. The one thing I will say is, and I'm sorry to hammer this point in because I really think it's important, is we all really have to start fighting the new war. Meaning, once again, I'm going to say this again, and I know this is a little bit controversial, but I think it's important to point out. There's the world before COVID and the world after COVID. Right now, we are on fire, right? Back then, there were battles, right? So public charge is a battle. There are no battles anymore. This is hand-to-hand physical combat to make sure that person by person, family by family that right now has been affected and impacted, that we are out there to help them. So we need to start rethinking in terms of what we do and understand the emergency that we are in. And for example, when elected officials out there say, oh, well, we just did a $2 trillion stimulus. Well, that's really nice. Ask any unemployed person if they have a single dollar in the bank account. Guess what? Not $1 has arrived. It will not arrive at the earliest for 3 weeks, maybe longer if you don't have direct deposit, which quite frankly, a lot of gig workers don't and live paycheck to paycheck or are getting paid cash. And so we're having a conversation where we have to be honest with people, which says, hey, if you don't have money and you were living paycheck to paycheck or cash to cash, you just showed up at a food pantry and that pantry ran out of food. That's an emergency. That's an existential crisis that we have right now. One of the things that we did, just so that folks know, because I do want to get it out there in a soft launch way, is that we actually put up a resource on our website, metcouncil.org/coronavirus, where we update every single day. We have one of our staffers updates every single day, metcouncil.org, all the relevant information and programs that exist, because it is so confusing in terms of how many programs there are out there. And it's basically a guide to say, you lost your job, here's what you do, file for unemployment, here's what's next, here's what bills you have to pay, here's what bills you don't have to pay. That's the first thing. And the second thing that we launched today, which was a soft launch as well, we're not publicly advertising it, but certainly you can refer people if you're out and watching this. For the 67 people who are watching this today, is we have rerouted our crisis social workers, where they're now helping people who have lost their jobs because of COVID. If they want an appointment, and I'll tell you why we're doing this, but if they want an appointment, they can email help@metcouncil.org, help@metcouncil.org, and they will get a 15-minute appointment where they can speak to a social worker who can walk them through that. And the reason is because you can't even get through to unemployment now. And if you try calling your cable company like I did, because now that many of us are working from home and we need more internet bandwidth, it took me 6 calls just to get a representative on the phone. Can you imagine how frustrated someone is who's never lost their job before, who now needs help? So we've launched that so that we have social workers who can literally hold their hand and walk them through that. And folks who are out there, feel free to take care of that service as well, which is help@metcouncil.org. But I want to encourage everyone to think about the battle that we're fighting is a brand new fight. We've never seen anything like this before. We really cannot even wrap our heads around the devastation financially that so many of our neighbors, and I want to say this again, your neighbors, people who were well off 1 week ago, have now lost everything. Think about that.
I want to agree with David that we have to understand the scope and scale of what we're dealing with is nothing we've dealt with in modern times. But I do want to say that the reason we have such a war now is because we spent decades losing these previous battles. If we had universal health care now.
We certainly agree, Joel. I'm just,
yeah,
100%. I just want people to just refocus and reposition to understand that we are in the worst crisis in our lifetimes. But Joel,
I get that.
I 100% agree with you. 100%.
But I just want to make sure we don't make the same mistake we made in 2009 in doing some temporary things to help the temporary crisis and not preventing the next one from happening. Having universal health care, unemployment insurance that really covers people, higher wages so people can save over time. And a specific example is the recovery bill number 2 that Nancy Pelosi pushed had some serious money for hunger in it. But recovery bill number 3, even though Schumer and Pelosi were pushing for increase in SNAP, Trump, McConnell and the House Republicans insisted that money come out as a cost of passing that bill. It would have been $10 billion for hungry Americans, increasing SNAP benefits. That sounds like a lot, but that is 0.5% of the $2 trillion. The average SNAP benefits $1.34 per meal now. It would have raised it to the princely sum of $1.54 per meal, but that was too much for them out of a $2 trillion bill. So we have a lot of fights at once.
Joel, I will add, I just think it's an important point. I'm ashamed to say that in New York State, where we have a Democratic-led executive, Senate, and Assembly, as I speak to you right now, on the last day of the budget that has to be wrapped up by the end of this day, the $25 million, talk about a paltry sum in a nearly $200 billion budget, the $25 million that we have requested has not been allocated. And that's in a Democratic state, right? It's very easy to say, hey, Trump, forget Trump, right? I can't throw out Trump until November. We live in a Democratic state and we can't get $25 million for hungry New Yorkers when 500,000 New Yorkers lost their jobs this past 2 weeks.
I also want to say you guys are really modeling in some ways like the idea behind this series, which is we both have to respond immediately to this massive crisis of tons of people in need right now, and also pay attention to the ways that pre-existing inequalities that we have allowed to fester are making it much more difficult for us to do that, and we need to be mindful about fixing them as we go forward. So I just think we can't choose between these two things. We must both do everything we can to come up with emergency food assistance, and I think that means individuals, right, making contributions to organizations right now, like Met Council and, obviously City Harvest and plenty of others.
Hunger Free America, gotta get that in.
Free America, of course, yes.
Wait, we're going to, let me just say, I'm just picking up with Brad. That was a great discussion. I think you're both right that we need to look at, be aware of what we didn't do before. That's why we started out with a grossly uneven set of playing fields that have been exacerbated every day of this virus. And we need desperately to look at what we need to do both short-term and long-term. I want to say to the people who, wait. No, I want to say to the people who are on this call, you've heard lots and lots and lots of statistics very fast. We want you to be able to use those, and Tess Summer, our program producer, will in fact give you a summary of some of what David and Joel have said, some numbers that you can use. But I think before we run out of time, we need to see from Tess if there are any particular questions she wants you to address from the callers. And then we want to wrap up by asking you, which you certainly implied, David, but what are specific things that that people could advocate for or contribute to, for sure. Tess?
Yeah, so I'm going to read you guys a question right now from an attendee. They were wondering what current or anticipated policy response is to support nonprofit organizations who are basically being asked to do more with less with significantly reduced funding streams. Are there any policies in the works that are going to specifically address that issue?
There is a provision in the last relief bill that should provide some help for nonprofits that will basically give us interest-free loans. And if we maintain our workforce without significant layoffs, they'll basically forgive those loans. So that will be a grant. But I suspect, we're just looking at how that's structured. It's really a drop in the bucket. And my plea for groups like ours, we don't do food distribution. Like groups like ours desperately need funding to help people access the government nutrition safety net programs. And I also think, not all nonprofits are created equal. I love some of the huge cultural institutions, but if their CEOs make a few $1 million a year, they probably need an extra boost less from a Met Council food pantry serving hungry people.
Yeah, I tell people that we're Met Council, we're not the Met. And the Met says they're losing $100 million and they might file for bankruptcy. They have a $1.1 billion endowment. We literally live month to month because whatever we get, we try to push out so that we can help people. I think specifically to answer your question, Tess, government has not done enough, right? I mean, the loan is nice, but realistically, most nonprofits who don't have deep resources are going to fold. I'm just telling you a fact here, and it's a scary prediction, but when we look back 1 year from today, you will see that many nonprofits are going to fold because they simply are not going to be able to maintain their payrolls and what they need to actually get done. The second reality is that while we're seeing an increase in individual donations, a lot of big donors have started pulling back on big donations because they've lost income. And as irrational or illogical as it sounds, it's difficult to tell someone who's worth 100 million, who now is only worth 32 million, you still have a lot of money. And so I can tell you that we've got a lot of donations that are out there that have not come through yet, which is very challenging. Look, we're fortunate that we are partners with UJA Federation. They came in and they gave us an emergency grant. They're also working with Hebrew Free Loan, who's doing amazing work where they're actually doing loans to people who have lost their jobs as well. But for the people who are watching online, honestly, I hate to say this, if you're relying on government to help your neighbors, it's not going to happen. I mean, we see that happening today. We need folks to step up, give what you can, certainly give to Joel Berg's organization, Hunger Free America, give to Met Council. We have an emergency COVID relief, metcouncil.org. Obviously support all of your favorite organizations, but we need your help now more than ever because there's no way that we're gonna get enough money to deal with this crisis because our costs are simply overwhelming. We at Met Council spend on average $1 million a week. We're now spending a little more than $2 million a week. Think about that. It's just not sustainable. I can't do this forever.
And one thing I want to add kind of in between individual contributions, which are needed right now, and the federal level advocacy, this gets to what David was saying, but so far, neither the state nor yet the city have come up with, emergency food support, just the basic refunding that David was speaking to at the state level. The city gives a meaningful amount of money, but obviously we need to give twice as much as that money right now, given the doubling of the need and the crisis. And so we will, when we follow up with people, be giving you information to call the governor and call the mayor and push for, substantial emergency food relief right now for the organizations that we're talking about.
Brad, I want to give credit where credit is due. You and your colleagues in the City Council and the Speaker of the City Council actually put out a statement a few days ago, and your body and the Speaker, Corey Johnson, was the first to do this, to say that when it comes to your opportunity to provide the budget, that you will provide emergency funding for food. And I think you need to be recognized for that. Obviously, the budget's a couple of months away, but it was an important conversation starter and commitment to really push others as well, and shows us how in the City Council you can actually leverage state action as well.
Thank you.
David, do you think anything will get added to the budget before tonight or not?
I honestly don't know. I've been doing this for 20 years, and I can tell you that one of the most mysterious processes in the world is the Albany budget.
I couldn't agree more.
We have legislators. I just want you to think about how strange this is. We have legislators right now tweeting that they're outraged that they just found out that food relief is not in the budget. So just think about that, right? I mean, which is that the process is so opaque that some legislators don't even have access to the information. So we as non-legislators certainly don't have the same access. And I think to Joel's point is, we certainly don't have the kind of access that the Fortune 100 companies have when they're lobbying for their stimulus packages. So we're on it. And while we've been chatting, I've been texting, and that's why I've disappeared for a moment or two to take a call, but we're trying our best. I honestly don't know, but I will tell you this, the fact that the budget's being wrapped up in the next few hours and it hasn't happened yet is really sad more than anything else. I want to be angry, but I'm not angry, because when I get calls, which I do all day and all night, from peoples and institutions and churches and synagogues begging us for food, and government hasn't stepped up, I'm just sad. It's really sad.
I also must point out that neither the city or the state can print money, and neither the city or the state can legally go into deficit. So at some point we have to talk about revenues. The state has over 60 billionaires. Their combined net worth is a few $100 billion, and the reluctance of Albany to even countenance that they would pay a few cents more to pay their fair share is the main reason, in my judgment, we don't have money for things like food programs.
All right, Brad, David Rosen is on the call. We were going to have him on a subsequent week. Maybe we still will, but since David, the Hebrew Free Loan Society COVID loan program got mentioned by David Greenfield, Tess can unmute you, I believe.
Ruth, I'm glad we're using democratic debate rules. If I mention one of my colleagues, they get to respond.
Absolutely. David?
Hi, I don't have video, but I'm happy to just talk through the audio and say that one of the most serious problems is how slowly resources are getting to people. We just had a rent day pass, and really the government help is on the way, but it's not here yet. And so one thing that we've been able to do is, first thing we were able to do is stop collecting payments on all of the loans we have out there. We've got thousands of loans held by lower income New Yorkers, and we just made a decision to suspend collecting those payments. So we're leaving an average of $250 in the bank account of people so that they can hold on to it and use it for basic needs. And at the same time that we're foregoing all of those repayments, which is what we usually use to make new loans, we are offering a lot of new loans and pushing out the availability of 0% interest loans of up to $5,000, which should get people through hopefully a month or two. And if you know somebody who needs to take advantage of this, our website is hfls.org. That's Hebrew Free Loan Society, hfls.org. And this is one thing that we can offer to get money into the hands of people very quickly, or to help them hang on to money that they otherwise would need to use to service the interest-free loans that they borrowed in the past.
Okay, thank you. And that again will be posted and will be shared with all of you. I just want to sort of go right back to the beginning and emphasize that whoever is on this call, and we love that there's so many of you on, you may know somebody who was increasingly food insecure because of this crisis, because they actually lost their job, because they can't go out shopping. And so, this starts at home. While you're looking at our bigger donation and volunteer and advocacy options, be sure to think about someone you might know who wants to take advantage of a loan or of a food delivery. Brad, you want to close us out? Tess, is there another question?
Yeah, just briefly, Joel and David, are you guys noticing that there are food shortages on the production end? I know that question has been on the minds of a lot of people, and as you guys are dealing with ordering in like mass quantities, is that something that you are concerned about or are noticing?
Yeah, I mean, I would say the biggest problem that we're really seeing, honestly, is not necessarily production, it's actually getting the food from point A to point B. And that's really exacerbated the situation where the anonymous folks, and I say this to point out how sad it is, because today they're the heroes, right? The people who are working in the fields and working in the warehouses and working in the grocery stores, those quote unquote anonymous folks, unfortunately, many of them are also struggling or becoming sick, and the truck drivers. And so we don't have a food shortage necessarily, but we have a challenge getting food from point A to point B, and that has driven up the cost of food. We, for example, had an order last week for 400,000 pounds of produce. It was canceled at the last minute because we were told that logistically they couldn't get it to us. So then we had to then go on the open market and purchase those same produce at a wholesale cost, but the items had already become more expensive, between 30 and 50% more expensive as well. Remember that multi-billion-dollar corporations like Walmart and Amazon will always figure out how to get food because they have unlimited resources, right? Those of us who are supplying food to food pantries, it's a tremendous challenge. We cannot compete with the Walmarts and Amazons of this world.
I just say there's still some spotty food shortages. We learned recently that there was just no infant formula on the shelves in Staten Island, but I'm pretty convinced that the food supply is pretty stable. There's some transportation challenges, but we've been assured both by the food industry and by the mayor's office and other authorities that the supply will continue. And the bottom line is people with money will be able to get food and people without it won't.
And that maybe honestly is like the right place to end here, because the problem is not that we don't have enough food. The problem is we aren't setting up a system to make sure that everybody who needs food, which of course is everyone, gets it. And that is something, there is no reason broadly in general for hunger in America right now at all. We could have a system that eliminates food insecurity. The great Jewish thinker Leonard Fine used to say that hunger in America is not a tragedy, it's a scandal, because we could choose, sorry about the dings, we could choose in America without food insecurity, and we have not built that because we haven't been heeding the words that Joel's been saying. At this moment, this crisis, as David says, the greatest crisis of our lifetimes, is presenting an entire new set of challenges when an enormous number of people who already were food insecure and new people who are losing their jobs, many of whom were middle class a couple of weeks ago. This call last night with 3,000 freelancers and writers and artists, not people who you think of, their income is gone, they don't have savings. So now we have to respond to that. The food is out there, but what it's gonna take for us to mobilize to get it into the homes of the folks who need it is an awful lot of work. We are lucky that folks like Joel Berg and David Greenfield are working like tirelessly right now. I see both of you out there all the time. Like it looks like both of you are barely sleeping in the food delivery work and the advocacy work. And we are really, really grateful for it. I know everyone on this call is. We're gonna send follow-up information to everyone on this call so that you can have all the links and resources so you can consider, if you're able in your own circumstances, to contribute to their and other organizations and take the advocacy steps to demand greater government resources to address this crisis.
Thank you. Thank you, Brad. Thank you, Joel. Thank you, David. Thank you, Tess. And I would love to just end by saying thank you to all the people who are doing the work that gets food to most of us most of the time, because they are many of the unsung heroes of this crisis. They are working nonstop to move food from wherever it is to wherever David picks it up and to wherever I go shop for it, or wherever it gets delivered. There are just thousands of people who are going to work every day at some risk to themselves. Thank you, Tess. You can close us out.
Thank you, everyone.